We know that there's a huge need for an affordable, comfortable prosthetic all over the world, but particularly in places that might have had a recent conflict and particularly with a focus on lower middle income countries. So Sierra Leone seemed like a really good place to start a project. We were lucky enough to be the recipients of a grant called part of the Assistive Technology Impact Fund, drive to increase access to assistive technology of all kinds all over the world. So Sierra Leone has a disproportionately large number of amputees, mainly because of a recent history of civil war. So, coupled with the fact that there are other factors that mean people might have an upper limb amputation, such as road traffic accidents and other things. So, it made sense that there was a huge need for what Koalaa does in Sierra Leone. But also, there is a massive lack of access to prosthetics there. So Nate and I traveled out there in September on a sort of fact-finding mission to meet some people in the government, but most importantly to meet some users or potential users of our prosthetics and our prosthetic service that we offer here at Koalaa. And we wanted to test this kind of clinic in a bag idea. Could we fit people with prostheses and provide them with a follow-up service? Could we do that anywhere in the country? So we did that over 10 days. We fitted around 20 people and it worked really well. We also started working with the National Rehabilitation Centre, which is the main organisation that's part of the Ministry of Health of Sierra Leone. What we don't want to do is just work independently in Sierra Leone, so that if we ever left, there wouldn't be anybody to carry on doing what we're trying to do there. So by working with the local government, it means that we can pass on our skills in terms of our specific service and how we're fitting prostheses and all the follow-up that goes with that to people in Sierra Leone, to healthcare workers there, so that if we did leave, it's a sustainable project and they can carry on fitting our prostheses and helping people out with that. That training program, we took 2 people that worked at the National Rehabilitation Centre, a prosthetist and a rehabilitation worker, and we designed a training program for them, a training course, in how to fit all the prostheses, what all the tools do, the cosmetic hand, and what kind of limb body service we offer in the UK and how that might translate to the Sierra Leonean context. The real icing on the cake at the end of the year, and this happened literally a couple of days before everybody went on Christmas holidays, was the 2 people that we trained alongside some other staff at the NRC, the National Rehabilitation Centre, went out to an amputee camp in Freetown, where a lot of people with amputations live in the same community, and fitted 8 people with Koalaa prostheses and sit down all their details so that we can do follow-up feedback and provide that limb body service for the first time without Koalaa being in country. So that's the first step to creating a sustainable service in Sierra Leone. And we're really proud of that. So that's how the year ended. And now we're here in January and we're looking forward to the next 6 months. And we're sort of in the planning stages of how are we going to take what we've learned so far and start to build it out across the country and reach as many people as possible.